Hey guys, Natural RN here today to talk to you about perioperative nursing. I just kind of wanted to give kind of a brief general overview of perioperative nursing as far as the stages. So if you want to know more about that, just keep on watching. So I am a perioperative nurse. I'm a registered nurse who works in a perioperative setting, which is pretty much a nurse who works with patients who are getting ready to have surgery or some type of invasive procedure, usually under anesthesia. So there are 3 stages of perioperative nursing. You have preoperative nursing, you have intraoperative nursing, and you have postoperative nursing. So in your preoperative nursing stage, that is when you are basically preparing the patient for the surgery for that day. As far as, they come in, if they're not already inpatient, they're going to come in, maybe with a family member or friend. At this point, you would get, a brief medical history of like allergies. Have they ever had any type of adverse reaction to any anesthesia whatsoever? Because that's a pretty big deal. You also want to make sure that they haven't eaten or drank anything since midnight the night before, unless instructed otherwise. Sometimes you want to make sure that they haven't taken certain medications in a certain period of time, like blood thinners or any other medication that they may be taking. Sometimes the physician will order for them to continue certain medications like their blood pressure medication or insulin or something like that. But you definitely want to make sure you know what they have had for that day. So physically, you want to make sure that the patient is ready for the surgery. But you also, in this stage, want to prepare the patient for the surgery psychologically, because surgery can be scary. People are nervous about surgery all the time. They have questions that you need to answer as best you can. Don't give any information that you can't give or you don't feel comfortable giving, because at this point, the doctor is going to talk to them anyway before the surgery to kind of clear up any final questions and kind of go over again what they're going to do during the surgery. But yeah, calming the patient's anxiety levels, kind of making them feel at ease. This is also the time where you get informed consent from the patients. There are a lot of times when patients come in and you try to get consent for them and they decide at that point that they no longer want to go through with the surgery. That can happen, if they're not informed enough. Key is informed consent. So if they're not informed enough or they feel like they just need to think about it more, you just have to make sure that you get that covered. So kind of in the preoperative stage leading into the intraoperative stage is kind of where I fall in. I am a nurse circulator, and what that is a registered nurse who basically coordinates the surgery. Not necessarily coordinates the surgery, but kind of makes sure that everything is good to go for the surgery. Like, I'm kind of the last checkpoint. I'm going to go through, the patient's chart. I'm going to look at lab work. I'm going to look at, make sure that the consent has been signed for the surgery as well as for anesthesia, because you need a consent for both. I'm also going to ask those same follow-up questions that the previous nurse before me asked, because we all kind of ask those questions multiple times. You'll go to the patient and ask them, what's your name, date of birth, what are your allergies, things like that. And they just most of the time start spitting them off because they've at least been asked. By the time you ask them, they've already been asked that about 10 times. So that's kind of what my role is. I'm going to follow up with those same questions, make sure that they still are good with the surgery, that they don't have any final questions that I or the physician could clear up. I'm also going to make sure that we have the medications that we need. for the room for the patient, like as far as antibiotics or anything that the doctor has ordered for them to have. If all of those things are good and, the patient's been seen by the doctor and has been, marked, if they're having like surgery on their right arm, you want to make sure that their right arm is marked, not their left, because we're not doing surgery on the left arm. So if all those ducks are in a row and everything is good, then we go to my part of the nursing stages, perioperative nursing stages, which is the intraoperative nursing. So in the intraoperative stage is where the actual surgery happens. So we take them back to the OR, we get them on the operating table, safely. I'm beside them the whole time as the nurse, because you still want to continue that care. You want to make sure that they are not anxious. You want to make sure that they know that somebody is going to be there the whole time, looking out for them, which is, essentially my job as the nurse circulator. I'm going to make sure that I'm that patient's advocate the whole entire time, because they are about to be put to sleep. They can't make safe choices for themselves. They're not even awake to be aware of what's going on. So that's pretty much my job. So we get them on the table, anesthesia's at the head. They're getting ready to put them to sleep. And then, essentially the surgery will take place after we've prepped them and draped them and all that good stuff, which I'll go into more detail about everything that entails probably later in another video. The last stage of the process is actually the post-operative care. So after surgery, we get them all bandaged up. They have to have somewhere to go. They can't stay in the operating room. So we're going to take them to what's called recovery, or sometimes referred to as PACU. That's where they're going to take them, kind of do their nursing assessment there and make sure, everything is good. Because from PACU, they're going to either go to their room as far as they're going to be admitted, maybe because it was a pretty big surgery and they can't just go home right away. Or it could be one of those surgeries where it was, minimally invasive and they're going to go home. But either way, the post-operative stage is to kind of assess and make sure that they're ready for either one of those options. Because if not, they can't leave that recovery area until they are ready, basically. So those nurses, they monitor them. They make sure all their vitals are good, blood pressure, O2 sats. They make sure that they are fully waking up. They can follow commands and things like that before they get to wherever their next destination is. So yeah, that's pretty much it. I just kind of wanted to give you kind of a general rundown of the process of the perioperative nursing. And I definitely have more content and more details on things. I just didn't want this video to get too lengthy. But yeah, there are a lot of things to talk about with perioperative nursing. I'll probably be talking about the perioperative 101 program in my next video. Kind of tell you guys things about that, but please feel free to comment below on more content that you would like to see from me, as far as different topics that you probably want to know more about as far as perioperative nursing. And please just like, comment, and subscribe, and thank you guys for watching.